Reviews continues. Now back to our host, Libby Collins.
You know, being around your pet makes you feel better, right? But have you ever considered training your own pet to help other people improve their quality of life? Well, joining us today are certified animal-assisted therapist Laura Hay and Wendy Panaro. She's a volunteer for Health Healers. And by the way, that's spelled with 2 E's. And in just a moment, we're going to also introduce you to a very special guest they've brought along. But Laura and Wendy, it's great to have both of you here.
Thank you, Libby.
Now, Laura, I'm going to turn to you first. What exactly is animal-assisted therapy?
Animal-assisted therapy is a goal-directed intervention where a professional like a teacher, a therapist, or a counselor uses a therapy animal, a trained therapy animal, in their practice to help them achieve certain goals or purposes with their clients or patients or students.
Now, you said trained therapy animal. Exactly what is the definition of that? I mean, I couldn't just bring my dog in and start saying to people, oh, pet him and you'll feel better. It's more complicated than that.
Right, right. There are national organizations that set standards for therapy animals. All of the therapy animal teams with Health Healers are registered with the Delta Society Pet Partners Program, which is the national organization. These are animals who they have established standards such as testing requirements for the animal and their human partner to go through in order to be able to do this kind of work. In addition, Health Healers provides on-site training that's very valuable to the handler therapy animal team so that they can really excel in their role as a volunteer team facilitating the goals with the professional.
Now, Wendy, I guess that makes you a human that's involved in the animal-assisted therapy. You're the human partner?
Yes.
Okay. Now, how were you drawn to this? What happened? What brought you to Health Healers?
In 2008, I had a 1 in a million cat enter my life. And I had read an article about therapy cats, but it was a place in Texas, and, you know, how do I do this locally? And so I actually called the Humane Society explaining what I wanted to do, and they're the ones who told me about the Delta Society Pet Partners and also Laura's organization, Health Healers. So there were local classes through the Delta Society, so I found the first one, got enrolled, and in November of 2008, my therapy cat Dexter and I became pet partners, and so we've been active for coming up now on almost 4 years.
And speaking of Dexter the therapy cat, who has his own Facebook page, by the way, is also joining us today, and I'm not sure what happened to him. I know he was coming over here getting well acquainted with me a moment ago.
He was just eating.
Oh, sorry, Dexter. You'll return to that in just a moment. But now, explain a little bit, what was the evaluation that he went through with Laura before he was accepted into the program?
Well, the evaluation I went through was actually independent of Laura. I got to learn about Laura's organization really more afterwards. So when they are evaluating an animal through the Delta Society Pet Partners, it's looking at their temperament. How do they react around wheelchairs, walkers, people who might stagger or gesture or talk loudly? We pass them to strangers. If it was a dog, they would take their leash and pass them to strangers. In a cat's case, they actually change arms. And how does that cat react, or that pet react to that handling? They drop something that would startle them, and it's not that the animal can't startle, but they want to watch the reaction and how does the animal recover. Mm-hmm. So they literally drop a stainless steel bowl while we're walking in our evaluation and watch the animal's reaction. And they try to simulate what it would be like in a healthcare field and try to watch that animal's reactions as they run through that.
We're here with Laura Hay and Wendy Panaro of Health Healers. Now, Laura, what, Wendy just said she has Dexter the therapy cat. I think a lot of people, when they think of animal therapy, automatically assume it's all dogs. Now, how rare is it to have a cat involved in the program?
It is very rare. We are very, very fortunate to have Dexter and 3 other registered therapy cats with Health Healers. Dexter and the other 3 are part of less than 200 therapy cats that are registered nationally.
In the whole country?
In the country. And so Health Healers has a nice representation of that number, yes.
So Dexter really is more than 1 in a million.
Yeah. He is.
Now, I guess the obvious question is, if a dog can be a therapist, if a cat can be a therapist, can any other animals?
There are other animals that can be registered, domestic animals, hamsters, guinea pigs, birds, bunnies, miniature horses, llamas, all have to go through that same assessment of temperament and being, stress-free or minimally stressed in strange environments. And
how important is the teamwork between the owner and the pet? I mean, I would assume both members are trained.
Well, we have to be a spokesperson for our pet. If we're in a situation, like if I'm out with little kids, I have to watch that those kids don't get too aggressive with petting, or even in a nursing home, or maybe an adult that has some cognitive or physical disabilities. You have to be careful that the petting is not getting too rough, although they do check that. That's another one of the evaluation things, is how does that animal react to something that might be a little above average. And, if the animal is looking like they're stressed, it's my job to look out for that, look out for him and, remove them from the situation or speak to the person and ask them to, try it a different way or whatever. So I just have to watch out for him. And because we encounter a lot of dogs, therapy dogs, obviously the therapy dogs are mostly very well behaved, so I've never really had a problem there. But if you're out in general public and any old dog comes up, I have to be very careful that that animal doesn't go after the cat, and he doesn't strike back at a dog that might be aggressive towards him. So you have to be that spokesperson for that animal.
Now, what sort of places and what sort of conditions do the people have, Laura, that you would bring in an animal for animal-assisted therapy? What is their profile?
Well, Health Healers really specializes in animal-assisted therapy program in a wide range of venues. We work with at-risk populations where...
Such as?
We've been in detention centers, St. Emila's Lakeside, school programs where children or youth are working on social skills, developing behavior management skills, and so on. We're in educational settings where children are learning basic education foundations like colors and numbers and size and shape, incorporating the therapy animal into that. We work in a number of senior centers where we bring in different activities, games, crafts, all related to the therapy animals, where the therapy animals are participating. We have programs through Head Start, where we're in the classrooms, Milwaukee Center for Independence. We're working with people with a wide range of general disabilities, physical and cognitive. So,
what I'm thinking is, particularly with the at-risk kids, what sort of progress have you seen, or maybe, Wendy, you've witnessed it as well, when they've been working with some of the animals?
The professionals that I've trained to work with the therapy animals in those settings have said that having a therapy animal present and using the curriculum that I've developed is like night and day. There was an instance of a young boy who literally was fighting almost every single day, and he was involved in the Compassion Through Canines program, which I created, and part of that, a component of that, is teaching the participants about how animals communicate with one another to avoid conflict and confrontation. And a few weeks into the program, the counselor mentioned to me that this child had not had a fight in a number of weeks. And sometime later I asked him, what happened? Why aren't you fighting? And he looked at the German Shepherd therapy dog next to me and said, if he doesn't have to fight, I don't have to fight. And sure enough, that child continued for months. I reconnected with the counselor and the psychologist months later, and that child still had not had issues with fighting with his peers.
That is tremendously rewarding.
Very rewarding.
Now, what do you think the animals get out of this? And let's look at Dexter, the therapy cat, for example. Wendy, after Dexter has been with some of the people and he's been out working, do you notice a change in his demeanor, in his mood? I mean, do you think that he's rewarded by what he's doing?
He purrs the entire way home, every time. He's usually tired when he gets home because, as you know, cats sleep a lot. But when he is out and he knows when he's going to work, he is, at 100% attention that whole time. He doesn't want to miss a thing. So his senses, I think, are heightened. I think he knows who to comfort sometimes when we go out.
What do you mean? Tell me about that.
I think I let him decide how long he's going to stay with each person. If I'm out on my own visiting and I've gone to a nursing home, sometimes it's I'll put him on someone's lap and he wants to get down right away. And other times he will settle in and I can leave the room and come back and get him in a half an hour. I mean, don't do that, but I'm just joking that he would stay there with that person. And it's usually, he seems to know that, that person just needed that extra. And I've had comments where people said, I was having a really bad day today. I'm really glad you stopped by. And so, he's purring the entire time he's with them. The person has a smile on their face that you can't wipe off because the animal makes them feel like they're the most important person in the room at that point. And
as he's doing to me right now, I want you to know you can't see under the console, but that's exactly what Dexter is doing.
And Libby's got a big smile on her face.
So you know that the time that you've spent out, even though you've taken out of your own personal schedule, has given someone else a pleasure and some enjoyment. And Dexter, like I said, will purr the entire way home.
Now, Laura, getting back to you, you had mentioned that the animals will pick up things from each other. Have you ever witnessed or seen any situations where the animals have sensed something about the patient, something that no human therapist would have picked up?
Well, I think as Wendy indicated, some animals just have this intuition where they know where the need is, and they provide that unconditionally. And I have seen several instances of that. Many of the therapy animals, that's part of what allows them to enrich the lives of people is because of that connection, that intuition for those who need them the most.
And so they'll be drawn to those individuals.
Yes.
Now, as far as the benefits of using animal-assisted therapy, what are the differences? Because your background is as an occupational therapist.
Right.
What are the differences that you see, Laura, between people who have worked with animals versus humans in comparable situations?
Sure. Well, for people who are fond of animals, the therapy animals really provide a motivation, a calming effect, and so on. And because of physical changes, actually chemical and hormonal changes that are going on in our bodies as we're spending time with these wonderful therapy animals, those things actually increase a person's participation, their performance, their accuracy on tasks, their ability to demonstrate nurturing behaviors or kindness towards an animal or towards another. And there was Dexter.
Dexter is agreeing.
Absolutely. Focusing better on what they're working towards. So we see lots of physical improvements, behavioral improvements, cognitive and emotional improvements. Hi, Dexter, etc.
Now, Wendy, as you've been out in the field with Dexter, what's your favorite moment? What stands out in your mind as kind of saying to yourself, this is why Dexter and I do this?
It was the very first time I took him out after I had gotten our registration. I was in a nursing home setting, and a lady was at a table, and her husband was there visiting, asked me if I would bring him over to her, and I did. And she smiled and petted him. And he said to me later that she had not shown emotion for several years. She was, Alzheimer's patient and just was emotionless. And that's the first time he'd really seen her respond in several years.
Oh,
and that was my first time out.
So that kept you coming back, yeah. I'm sure.
Yeah.
Now, as far as people who might be listening and they're thinking, gee, I have a really nice dog or a lovely cat and I'd like to share them with other people, I think this would be a great experience. What would you suggest, Laura, that they do? As far as, is there, like a little home assessment you can do before you bring them in for a formal evaluation?
Absolutely, there is. One of the things that Health Healers provides is a free screening where I assess an animal's potential for therapy work. So I look at temperament and behavior, obedience if it's a dog, social skills, stress levels, and things like that, so that people have an idea of the potential their pet might have before they move forward in the process towards the therapy classes or the therapy test and registration.
And how long does that take to go through the actual process of classes and training?
Well, the classes that I offer are weekly classes. It's for 4 weeks. After the classes that many people take as a way to prepare for the therapy animal test, the test is done with a individual therapy, potential therapy team, the handler and the therapy animal. They take a test together, and then they submit paperwork to the national organization. Then that paperwork is turned back around to them with their acceptance letter. So it's usually a matter of a couple months, I would say, at a minimum, to be able to go through that process.
I'm sure there are a lot of people thinking, okay, my dog, my cat would be perfect for this. Now, if they want more information, how can they reach you?
Well, they can reach me by phone at 262-442-9633, or Health Healers has a website, healthhealers.com. Again, Health Healers is Healers is with the double E, and a Facebook page, so they can contact us through any of those means.
And speaking of Facebook pages, Wendy, I understand Dexter the therapy cat has his own Facebook page.
Yes, he does. I just started it, and he already has quite a few likes. He's going to have more likes than I have friends. So it's Facebook.com.
You mean it's going to be a competition between you and Dexter, who has more friends?
Yeah, exactly. Facebook.com / Dexter the therapy cat. Check him out.
Well, I want to thank you, Wendy Panaro, for being here today, and Laura Hay, and most of all, Dexter the therapy cat. Thank you so much. Health Healers, and again, that website,
www.healthhealers.com.
Thank you, Laura.
Thank you, Libby.
Thank you, Wendy. Thank you, Dexter. And for 94.5 Lakeview's, I'm Libby Collins.